that come in my office.
Good suggestion.
Oh, yeah.
Buy them a little rolling
Yeah, I was
bag.
thinking of that.
But
They should all be rolled.
Because your books are putting
Let me tell you, in schools today, they're so strict on what you can and cannot do. If it's not policy, you can, something can be carried there and someone can trip over it and fall and get injured. I
Or
think it's more of a liability.
how do you get
issue.
in on the bus?
Right.
I mean, if you have one of those rolling things, he has to climb 4 steps up to get in the bus.
Yeah. It's more of a liability issue,
Well,
I
then,
think, in the
what
schools and
would you
everything.
do about the books?
Well, that's the issue. Even in high school today, kids are running from class to class, but they don't have time to go back to their lockers. So they're carrying all these heavy books. And
And we're
that-
actually looking at Kindles now.
Yeah.
Just
And-
put all books on a Kindle.
And
Well,
it
it's
puts,
gonna come to that because.
They are developing some.
yeah, well, right now, I'm working with some of the local high schools right now, and actually grade schools as well, because we gotta get awareness out there.
Yes.
Because this is something that is just
Well,
becoming, it's becoming an epidemic. If you're 6 years old, and you have neck and back problems, from a non-forceful, from a non-forceful activity, just like carrying a book bag, as you continue to get older, and you're working on computers, and you develop even more repetitive stress disorders over a period of time, I mean, a 6-year-old by the time they're 12 or 13, I mean, could be in real trouble if they don't get treated. So,
Schools have gotta buy Kindles
well,
instead of books.
we're working right now to get the awareness out there and working with different local high schools. And that's going to be a seminar I can promise is going to happen over in the next few months. Yes, yes.
I can vouch for that exercise.
Yeah, we've been doing them. Walt's been a patient of mine for a few years, so
Trying to learn more about
he's living proof. Now, some strengthening exercises that we can do. Now, you all should take one of these TheraBands with you, okay? I can show you how to use it. But when you're dealing with any type of posture-related injury, okay, the first thing you have to do, you have to strengthen a muscle, okay? So when someone comes into my office and they're complaining of neck pain or shoulder pain, some of the exercises that we do, again, standing straight, you have a little scissor stance because that gets your base. If you're standing like this, someone can push you right over. So you want to have a base, so you do a little scissor stance. You're holding the bands up like this, and you're raising up, okay? It gives you a little bit of resistance. You're working your shoulder muscles, and you're working your upper back, and you're working the neck, okay? You can do front raises, they're called. You can do what's called side raises. You're going up and down. You're working the sides of your arms, and again, in your traps and shoulders. You can do something where you do even a press. You see people, you can do a complete body workout just by using these bands, and it gives you the resistance that you need. So, when your body is put back in the proper alignment, you have to strengthen the muscles afterwards. This is why if you were to just do exercises and do postural exercises and muscle strengthening, that's all great. But if you don't realign those bones that are being out of alignment, you can do exercises till you're blue in the face. The problem's going to keep coming back. We need to realign the bones first, take pressure off the nerves, then exercise, and then strengthen the muscles, because that's what's going to bring you to your optimal level.
How often do the bones have to be realigned?
Everybody's different. When people come into my office, if they've had prior chiropractic